This video will help you to relax when having your blood pressure taken at the doctor's. And it's especially helpful if you have white coat syndrome, if you have a fear of going to the doctor's, or if you have a social anxiety. Hello, my name is Claire and welcome to Generation Calm, where you can learn to reduce your stress and anxiety naturally in your own time so that your mind and body feel great. So we're going to be talking briefly about what is white coat syndrome. But keep watching till the end because I'm going to give you 3 tips that you can use to relax when you next have your blood pressure taken at the doctor's. So I recently wrote a blog post about white coat syndrome, and it's when your blood pressure is uncharacteristically high when you go to a clinical setting to go and get your blood pressure checked, even when in a normal setting your blood pressure is absolutely normal. And that's because the stress and anxiety that you feel when going to the doctor's, it makes your blood pressure spike. It also makes other things, like your heart rate spike too. But when it comes to blood pressure, the numbers are everything. High blood pressure has no symptoms. So the doctor can only go by what numbers he's seeing. And if every time you come into the doctor's surgery, you have high blood pressure, they're going to start thinking that you have high blood pressure or hypertension. So it's named white coat hypertension or white coat syndrome because normally a lot of doctors will wear a white coat, but it doesn't necessarily mean that it's the white coats that make you anxious. It is the clinical setting itself. Now, some people might have high blood pressure readings at a doctor's compared to at home for other reasons. It may be that they have a social anxiety, and that means that they get anxious about talking to the doctors or being around other people. It might be that someone has a health anxiety, and so they're worried they're going to get bad news when they go to the clinic. It might be something completely random, like you've ridden your bike to the doctor's, and so your heart rate is up and your blood pressure's up. So if you suspect that you have white coat syndrome, and that means that your blood pressure only gets super high when you're in a clinical setting, whereas it's normal at home, then I encourage you to talk to your doctor about having a 24-hour monitor. If that's not possible, try and get yourself an at-home blood pressure monitor. And if that's still not possible, then try an in-store public blood pressure monitor. The only trouble with those is that maybe the cuff's going to be too big, and if you get anxious going to the doctor's, you might get anxious being inside a store publicly having your blood pressure taken too. This gives a more accurate reading of what your blood pressure is normally, and not just what it's like when you're interacting with nursing staff. And thirdly, if you do have to rely on a clinic to have your blood pressure taken, then I recommend that you use the guidelines that are put out there by the American Heart Association. So they recommend that you make sure you've had no caffeine and you haven't smoked for at least 30 minutes prior to your appointment. Make sure to keep your cuffed arm rested on a table and keep it at about heart level. Keep your feet flat and planted on the ground. Keep your back straight. And make sure that you don't talk to the physician. Now, I encourage you to ask them to retake it in a minute's time. And even if possible, maybe towards the end of the appointment, so that you get a comparison reading of before and after. And there are other things you can do to help yourself when you are having your blood pressure taken at the doctor's, and one of those is taking a book with you or listening to some music, making sure you get there early so that you're not feeling rushed and you have time for your blood pressure to come down naturally. And that also gives you the opportunity to try out some relaxation techniques, and I've got 3 that you should try for your next visit to the doctor's. The first one is the mindfulness technique called the 5-4-3-2-1, when you look for 5 things in an environment that you can look at. And then notice 4 things that you can hear, 3 things that you can feel, 2 things that you can smell, and 1 thing that you can taste. Now, this is designed to keep you focused on the present moment, what's going on around you, what's going on inside of you, and to take you away from those intrusive thoughts that can happen when you go to the clinical settings. So the second technique that you can try while in a doctor's surgery to bring down your blood pressure is a breathing technique. You breathe in for 4 counts, you hold it for 1, and then breathe out for 6 counts. If you can't remember the numbers, don't worry about it. Always breathe out for longer than you breathe in. This really helps you to put yourself back in control and create that calm for yourself. And it's amazing how quickly a breathing technique can bring down your blood pressure. And finally, repeat a positive word or phrase. Some people call that a mantra. Something like, I am at peace, or I am safe, I am healthy, strong, and full of vitality. Repeat this to yourself silently in your head as your blood pressure is being taken. And join me next week as I upload 5-minute meditations for 5 days next week. And they're all designed to help reduce your blood pressure and put you in control of starting your stress management program. Thanks for watching.